Hello, my name is Melissa Perry and I am a Democratic candidate for Hampshire County Sheriff. Currently, I live in Northampton and I was born and raised in Northampton. I am 54 years old and I am currently the Director of Behavioral Health Nursing at the Holyoke Medical Center. I have a bachelor's degree from Westfield State University in both criminal justice and psychology, and I have an associate's of nursing degree from Holyoke Community College, and I am a registered nurse. I am the granddaughter of the late Sheriff John F. Boyle, and my parents, George and Carol Perry, were both correctional officers at the Hampshire County Jail and House of Correction. At the time when I was growing up, the jail was on Union Street, and at that time, sheriffs lived in the jails and houses of correction. My grandparents had their apartment on the top floor of Union Street. This gave me much exposure to the jail on almost a daily basis. The year prior to my grandfather's death, I did a year's internship at the jail, which gave me insight to the inner workings of the inside of the jail and the House of Corrections. Seeing the work done by my parents and grandfather helped me form my passion for those in need. In my current position at Holyoke Medical Center as the Director of Behavioral Health, I run a 20-bed locked inpatient psychiatric unit. I have a team of behavioral health staff also in our emergency department. Currently, I manage approximately 115 employees, nurses, social workers, psychiatric clinicians, and mental health assistants and secretaries. I have worked collaboratively with my team of psychiatrists on a daily basis. I am responsible for hiring and firing, staff evaluations, and yearly education. All of this experience, I think I could move over to the criminal justice system. I have assisted in writing and the implementations of grants for the hospital to improve programming for the mentally ill. I have worked closely with the Department of Mental Health over the years, and I am very well respected in the department throughout the state of Massachusetts. I have heightened awareness of mental health issues in my hospital as well as the community. I have worked collaboratively with the Department of Mental Health and with persons served, people with mental illness, to bring the department, persons served, and the staff at Holyoke Medical Center, including security, together so that each would have an understanding of the experiences on both sides of the fence. We called these community conversations. I have excellent interpersonal skills and leadership skills. I was named as the #1 leader in Valley Health Systems in 2015, which Holyoke Medical Center is a part of. I would like the opportunity to work with the criminal justice system the same way I have worked with the Department of Mental Health. I would also like to engage the Department of Public Health, the Bureau of Substance Abuse Services, and SAMHSA, the Substance Abuse and Mental Health Services Administration, together to create preventative programs for people to keep people out of jail, programs for the inmates while they're incarcerated, and in my opinion, the most important post-incarceration programs to keep people from reoffending and ending up back incarcerated. I have much experience, and because 60 to 70% of inmates in jails and prisons have a mental illness or substance abuse diagnosis, I believe I would be a huge asset to the criminal justice system and the way it functions in today's world. I would like the opportunity to represent the county as Hampshire County Sheriff, and I would like to be given the opportunity to make changes.